Otia serikali ikapinduliwa, mtu mwingine akekwa, but anyway, that's my classmate. So, yeah, fourth year came, fourth year again, no reconstruction, fifth year cosmetic. And eventually we finished again, completing 5 years without any supplementary.
Vile inafaa, vile inafaa.
Thank God.
That's a very blessed guy.
Thank God. Yeah, my maombi ya mzazi stias.
Yeah.
Na maombi ya shosho. Shosho ananiombea.
Shosho anamwambia prophet.
Na mzazi pia. So we finished school. I'm privately sponsored, so siko county. So niko na leeway. Yeah, where I want to work. This church was sponsoring me to teach at a medical school in Rwanda. So yeah, so this church began a medical school in Rwanda. Tukiwa bado shule. I think the first class is 950. So they want us to go teach in Rwanda. So we go there last year and we see the I think it's the...
So you finished med in
2023.
2023.
July.
Okay.
So graduation was December. So we finish and then we go to Rwanda, get to see the school. I think that's the best medical school. In terms of infrastructure, that is the best medical school.
So this
is in South Africa.
State of the art should be doing, not taking taxpayers' money.
Well, yeah, shule imejengwa hapo. State of the art medical school in that place. Pristine. So they have that anatomy thing. Grey's Anatomy. So nice. Anyway, so yeah, that's my story.
So are you going to teach?
Yeah,
you're going.
Plans are still underway. The discussion is still underway of whether we'll be going to teach full time or online.
But you are heartbreaking your patient.
No. I'm still in Kenya.
I'm not Rwanda, yeah, but
there's still SDN Church in Kenya. So at the moment, they are plastic surgeon in the SDS hospitals in Nairobi. Nairobi Adventist, Better Living. So Rwanda is more of a bonus, really. And he's teaching job. You can teach online. So I'm still around. And now Coptic, because of the long-standing relationship we had, I approached the medical director and told him, you know what? You do not have a plastics clinic. Why? A big hospital like Coptic needs to have their own plastic surgery clinic. Not the one run by private doctors. Because what used to happen is that consultants would send patients. Their own patients. They're admitted. And why don't you have our own clinic run by your own person? And then now, so I wrote them a proposal with profits and all that. And, they eventually agreed. And I became a resident plastic surgeon.
At Coptic.
At Coptic, the youngest. And now...
You are the youngest consultant ever.
Nikimaliza, when I was graduating, I was 2023, I was 30. So I was born 93. So I became a surgeon at 30. And that was actually my log... whatever triple I got. By the time I got 30, I masters. And it happened, and I always thank God for it. So, yeah, I became a consultant at Coptic. Now that is something that has never happened in Coptic, because for you to become a resident surgeon in Coptic, you have to have worked 5 years post specialist recognition.
So that's like 7.
The last 7 years. Post graduating. And me here,
you're fresh from school.
I'm now a resident plastic surgeon, fresh from school. Now, there was a Dr. Nangole, Professor Nangole now, who was the one who used to take care of the emergencies. So niko like, sasa kimapia daktari napewa hii slot, ataonaje, atafikiria aje sasa namnyang'anya kazi. Because most people think that. So I approach him and tell him, Doc, I'm being offered an opportunity to become the resident plastic surgeon at Coptic. What do you think? Then you'll be the one supervising me because I'm still junior. It's like, yeah. I was so surprised. No, but that's a very good thing. Just go for it. And I'm like, hey, you can't expect to kasirike na kunyang'anya wagonjwa. It's like, no. This practice is so wide. Patients are so many. If you even want me to assist in theater, I'm available. Wow, don't I have the best supervisor ever? Long story short, it's been almost 2 years now. Being the resident plastic surgeon. We've done a couple of cases from reconstruction to cosmetic. Last week I was doing a breast reduction there. We've done a few liposuctions, Brazilian butt lifts, and all.
What's your favorite surgery? Brazilian butt lift?
My favorite surgery, I'd say, is all of them. I think every surgery in plastics is just interesting because there's no monotony in plastics.
There isn't.
In plastics, today you're operating on the scalp. You're doing a wound on the scalp. You're doing a flap on the scalp. Tomorrow you're working on the eyelid. You're reconstructing the eyelid. The next day you are told that there's someone whose girlfriend beat his nose, so you have to reconstruct your nose. Then there's a guy who's been beat on the lip. You're reconstructing the tongue.
You're repairing a cleft palate.
You're repairing a cleft palate. You're repairing a cleft lip. Someone's tongue has been bit off, so you have to repair. Then the next day you're doing a breast reduction. You're doing breast augmentation with implants.
So it's a head to toe.
Breast is head to toe, basically.
What about
from
gender reassignment?
So now,
fine.
let me now tell you now the full spectrum of plastic stuff. Plastics is very wide. Okay, it's a very wide field. That's why it has a long name: plastic, reconstructive, aesthetic surgery. Okay, so how this thing is divided, there is reconstruction and there is aesthetic bit. Now reconstruction, there's head and neck, there's chest, there's abdomen, there's limbs. Okay, head and neck, chest, abdomen, limbs. So we have found everywhere in the body. Okay, so head and neck, now you'll have now your reconstruction if you have a wound, say if you have a tumor on the scalp, if you're doing separation of conjoined twins, the plastic surgery, because the neurosurgeon will separate
the brain.
But how will he cover that part that was doing to Kenneth's
skin?
That's when the plastic surgeon comes in. And then you have head and neck tumors, okay? We used to have something called head and neck tumor board, together with ENT and maxillofacial, whereby they remove the tumor, we come in and reconstruct. Okay.
So if you work alongside all
multidisciplinary, we work with almost all specialties. So in the chest, if you're doing reconstruction, chest tumors, trauma, okay, breast malignancy management, gigantomastia, that's breast enlargement, we do the reductions. If you have patients who've had a part of the lung removed, okay, due to tumor or something, you need to come in and fill that space so that so there are various types of flaps. You could use the latissimus dorsi flap to remove a flap, the omentum from the tummy, slide it under the diaphragm. So as a plastic surgeon, you really need to be very good in anatomy.
Evident.
You have to be very good at anatomy because uko kila mahali. So that's why I love anatomy so much. Now, the abdomen, there are tumors, the abdominal tumors, especially in the skin, the dermatophytosarcoma.
Do you have a private practice?
I do have a private practice, so we get there. So then, the penis also, we do a lot of reconstruction on the penis.
Enlargement?
We do penile enlargement.
Right.
That is coming now in the aesthetic bit. Gender reassignments is still part of plastics. But in Kenya, we don't have those governing gender reassignments. So it's not too. But we have gender affirmation surgery spectrum.
So those are
for kids.
Ambiguous,
for kids with ambiguous genitalia, those ones, we do have a bit of provision in them. Then for ladies who have vaginal issues, vaginal atresia, congenital vaginal atresia, we do vaginal reconstruction, vaginoplasties. There's even a paper I did. And I guess we did. Patient was born with vaginal atresia and we were able to reconstruct.
You
recreate. You can either use that using the skin on the medial thigh or the colon. You can actually make a vagina from the colon. The large colon. The large intestine.
Kuna vitu unajustify hapo kazini. Kuna watu wako like, oh god, they say.
You can actually take the colon
and there is the
segment of the colon and make a vagina.
But is the mucosa because this is 30% spermatitis?
The mucosa eventually adapts.
Or it adapts.
And eventually the mucosa will always adapt depending on the stress. So, but the common one is we use the Singapore flap. We take this inner thigh skin on both sides, we make it into a tube. Then the gynecologist comes and makes a way. And recreates the path there.
But this is in babies, right?
No, even in adults. The case we did, most of the cases we do are in adults. Then you recreate the path, then you put it there. Otherwise flat. They do have a trees here.
So, okay, so like it wasn't caught until adulthood or what?
Or rather it was caught, but there was no mess
it
to
wasn't.
prepare. Okay? Because if they have a trees here, they'll not have menses. Then the uterus will get developed, but they may have an ovary. So they develop secondary female sexual characteristics and all that. Yeah. So there'll be no more females on the outside, and even the vagina, the vulva, the outside will be well formed. Toris is well formed, the lips are well formed. But now,
there is no
2 centimeters going in. Remember the embryology? The vulva has different embryology from the vagina to now. Yeah, so the vulva is from ectoderm with the other one. Yeah. So, then now the limbs, trauma basically. And the constructions. So, aesthetics now, on the other hand, you have your hair transplants. Okay.
Which is happening in Kenya.
It's happening in Kenya. Happening in Kenya a lot. Then you go to your also do ear reconstruction. So no. EAT will work on the canal and the hearing system and all. But the pillar itself, the reconstruction now is plastics. You take a rib, cartilage from the rib, we shape it into an ear, insert it in the skin, and you're able to lift it off, and it looks like a normal ear. Then you have plastics is very interesting, man. Plastics is very, very interesting.
Speaking of Pijibamba, you're always doing challenges on social media.
Sasa, let's talk about social media. Let me tell you now, when I was in school, there's no day I ever thought of doing such things.
You were a serious SDA person.
I was a serious student. SDA person at is. There's only like serious SDA. SDA just a really instant. Really, I'm good too.
How did you start that?
So now, I used to post on my WhatsApp, post medical content on my WhatsApp, post status. So
now for plastics as well?
Yes, plastics. So post maybe here after school, that is. If you are sure that, let me tell you, when you're in school doing Masters of Medicine, you need to keep a low profile.
Yeah.
Low profile. Hata isemekanage tu we unapuanga tu, hata uogeagi. Okay? So that's MMed. Passing medical, passing Masters. Passing Masters is you read hard and you make sure you're politically correct. Usiongee sana. Kaa tu chini. Kenye unaambiwa unafanya. Unataka nikuwe wambi sawa, nakuja. Unanitaka what? Line imetoka? Nakuja. Tunepigia simu for very hot things. Sijui patient akufanya nini. Anyway. So now, after MMed now you realize, okay, now when you got so sasa, hakuna kitu utafanyiwa hivi. As long as you stick to within the board regulations, there's the board to guide you.
Now you know.
So now I start posting on my WhatsApp status and my friends are like, Lord, but uko TikTok? Unaweza kuwa ukitufunza hizi vitu. Kwa sasa WhatsApp after one day imepotea. No. So so I do my first post on TikTok. I think it was on hair transplant. And then nikafanya, and then only got 2 views. So like 3 months before I had posted, nilikuwa nimepost nikikula maembe. Nilikuwa nimepost nikikula my very first TikTok post nilikuwa nakula maembe. Shagogo, very sweet. Na hiyo maembe nilikula nikiwa MMed. Siku hata ninaota but singepost.
Ulipost after.
1 year later they were like, by then niko na kamera naweza post. So nikapost nikikula maembe, then it gets 6,000 views. Like,
kukula tu maembe.
Nilikuwa tunakula maembe and 6,000 views. So anyway, I do my first posts. It gets a bit of traction and all that, but then you realize TikTok, people don't come to TikTok to learn much.
Yeah.
Someone comes to TikTok because they've had a long day.
Yeah, and they want to relax. So how do I make my content appealing to people and still educate them? So you integrate a bit of humor and a bit of knowledge so that at the end of the day, you know what you want to communicate. You want to communicate the knowledge. That's nice.
So, lakini ukipost medical contents here on TikTok. Ukipost medical contents here on TikTok. Na uko serious hapo, teaching people very good things. But getting to 1,000 views hata ni ngumu. But wewe fanya tu jinga tu.
Yeah, so in that comedy, you can integrate now a bit of medicine, a bit of what you do, and at the end of the day, end up educated. Because I realized there are so many people out, including doctors, including consultants, who do not know what plastic surgery is. We have so many consultants who do not know. Ikifika hapa, you really need a plastic surgeon. Okay? With these bands, from simple things as bands, this type of band, a general surgeon may not be able to manage it adequately. You need a plastic surgeon. So, and TikTok reaches a big audience. So you decide, you know what? Let me teach them medicine, but also communicate, and also at the same time have fun. Because it's TikTok, yes. So hakuna mtu anajoin TikTok kuja kunini class. Nakuja tu ku have fun, kujibamba, and get the information. So the personality you see on TikTok is still me, but now because growing up was also a bit tricky about it. Hatungekosa kwa hizo noise makers. In fact, in primary I was even made a prefect. Class 7, remember you
were in choir.
Kitwini, hiyo ni primary. Primary tuko kwa but
You did high school that is.
so high school ndio tulianza kuwa serious na maisha. Anyway, so yeah, basically that's how I ended up on TikTok. And I did the 1, 2, 3 videos, zingine zika blow out. Zika blow up, so yeah.
And here you are.
From
several